Morning's meeting to order. First of all, Jenny will be probably late, or I don't know if she'll make it or not, but she may be late. First thing on the agenda today is the approval of the agenda.
Move approval.
Second.
You've got a motion by Commissioner Campbell, second by Commissioner
Kaylee.
Kaylee. Okay, I'll get your names down here. All in favor?
Aye.
Aye, opposed? Okay. Next thing, we have our employee recognition, first of the month, and we've got two people today that we're going to recognize. First one we got today is Joe Olson. Joe Olson, we're going to recognize for 15 years of working here. Probably seems like 30 to you. Joe, thank you very much for all the years of service that you've done, all the work you're doing here. And Steve, are you going to
Yeah,
a few words here?
I could, Mr. Chair. Joe, we are extremely fortunate to have Joe as an employee here at Clay County. He comes every day with a can-do attitude. There's a few of our departments here that you wake up in the morning and go, you know that you're going to be faced with a challenge every day, and Joe comes with a driven attitude to do what's best for the county. Excellent customer service. He's always focused on making sure that it gets done and it gets done right. We're still working on his ability to tell us no sometimes, but it's a great to have Joe on board. So thanks, Joe.
Thank you very much, Joe, for your work. And then from the assessor's office, we got Lisa Kunze. Okay. She's got 20 years of working here. Very good. And Nancy, you got a few words you'd like to? Congratulations, Lisa.
Congratulations, Lisa, on your 20-year anniversary with Clay County. Lisa started off in the recorder's office, and about 6 years ago, she made a career change when she accepted the position of appraiser in our department. Lisa is a hard worker, has a strong commitment to public service and great customer service. And if you've ever worked on a committee with her, you know she's extremely dependable, and she will get the job done. So I just want to thank her for all of her years of service, and all the best as you work towards your next milestone. Thank you.
And with that, we'll move on to citizens' concern. Are there any citizens in here that would like to speak for things that are not on the agenda? Okay, Steve, do we have anybody?
Nothing, Mr. Chair.
Okay, thank you. Then we'll go on and move to the approval of the bills and vouchers.
Move for approval.
Okay, we got a
Second.
motion by Commissioner Ebinger and second by Commissioner Kaylee. Anything else in that? Not? We'll vote on all in favor?
Aye.
That will move on to approval of the minutes from April the 19th.
Move approval.
Second.
Yeah. Got a motion by Commissioner Kaylee and a second by Commissioner Campbell for approval of the minutes from April the 19th. All in favor?
Aye.
Now we'll go on to request to fill 4 vacancies from the corrections officers, Carrie Tootin and administrator, and Katie Johnson, assistant. And it looks like Mark's here too to help out.
I am, Mr. Chair. And Mr. Chair, if I may, and Commissioners, I would just like to take a moment to recognize our correctional officers this week for National Correctional Officer Week. Our correctional officers do a fantastic job for us over there. They were doing great work prior to COVID, but ever since COVID came around, they really showed their true colors and how well they can work and adapt and overcome over some stressful times and circumstances. And we really appreciate their work and their efforts that they do for Clay County to ensure the safety of the inmates in our facility. So thank you, Carrie and Katie, and thank your staff.
Well, I too would like to recognize that of the week all the good service that you guys have done for our county. And thank you very much for that. We appreciate what you guys do.
Thank you.
Okay. Now we'll move on to hiring four full-time correction officers.
Yes, that's right. Good morning, Commissioners. So we are here to request 4 new correctional officer positions for our facility. We recently had 3 resignations that we knew were coming, and 1 promotion to sergeant. So, yes.
Is this just to get back to full staff again then, or we're not at full staff yet, huh?
No, we're not, sorry.
Okay.
We're working at it.
Okay. Go ahead, Commissioner.
Yep. Do we have a list, or do we have candidates for these positions at this time?
Yep, so we do. We have 3 in backgrounds right now. We have 5 that we have recently hired and are going through training as we speak. So,
That's great, so we're close to being full staffed.
no, we are still down 9.
Okay.
We are still down 9.
Will that
But
be,
we're constantly hiring, we're going through interviewing. Since I started, we've had 27 interviews. We've handed out 20 backgrounds. 16 have been turned over to investigations. Let's see, 4 have been denied through backgrounds. Let's see, 5 have been accepted, and actually 6 have been accepted and started training.
Well, I understand, and this is something we're hearing with street and road deputies and dispatchers and corrections from all over the country and in the state. And you guys are doing the best you can do, but please let us know if there's something we can do. I know we've got sergeant positions and we've addressed some of the concerns of the staff on making things, they're pretty happy, but making them happier. But this is a good career, and I hope you guys have plenty of luck. Let us know what we can do to get people in the job.
It is, and we have explored, there's a couple websites we're looking at too. Also, we've been in touch with it's like alumni emails that will get sent out, and we're going to be a part of that now, where they're going to shoot out our application process to those alumni. So hopefully that'll help too.
Great, thank you.
Yep.
Hey, Commissioner Campbell?
Yeah, Sheriff, has there been any more discussion with the Career Academy in terms of maybe launching some sort of a preliminary type of a opportunity here?
we have not had those discussions at this point. I think they're still trying to get some of their programs up and off the ground. And once they do that, we can start to reach out to them and see if we can have something like that. What I have been doing is I've been reaching out to the colleges.
I know at the intergovernmental retreat, we had a presentation on the Career Academy, and I think that was one of the items that it kind of showed up as a future possibility. And I kind of think the squeaky wheel gets the grease kind of thing, and if we can kind of keep suggesting that to them, that this is a golden opportunity, and maybe even for some of our local kids to look at this as a career opportunity. So
Be all in favor of that, absolutely.
anything that we as a board could do to help with that too, like Commissioner Ebinger said, I think we'd be more than happy to assist in at least promoting, that possibility. So
Thank you.
with that, Mr. Chair, I would move approval of the request.
Second.
We got a motion to approve the request to hire 4 full-time correctional officers. There's a
Second.
second by Commissioner Ebinger. Any further discussion? All in favor?
Aye.
Opposed? Okay.
Can I just take a second too to make sure that Katie and I wanted to reach out to our staff too over at the correctional facility just to make sure that we, and this is to everybody who has served in the past in our uniform, past and present, how remarkable that they were as COs and that they are now. They have been through the ringer in the last 3 years, and they're just amazing individuals to do what they are doing. So we just wanted to touch base with them.
Absolutely.
Okay.
And also, Commissioners, I think it's important for you to be aware that Katie and Carrie are both going to be humble, but since they've taken over as the jail administrator and assistant jail administrator, we've been able to bring all of our inmates back to our facility, so we're no longer housing inmates out, which is a cost savings to the county.
Thank you very much for that. I mean, we do appreciate the work that you do, and thank you so much for being there and staying with us. Okay.
Thank you.
And with that, we'll move on to the update on the avian flu from Gabe Tweeten, our emergency manager.
Good morning, Mr. Chair, Commissioners. Just to give you a quick brief on the avian flu epidemic, Minnesota's response, and what's going on here in Clay County. So the highly pathogenic avian influenza first appeared in Minnesota back in March. It is particularly devastating to commercial flocks. Those type of birds have very low immunity systems. And then also backyard flocks. And it is spread through migratory birds, mainly waterfowl and raptors. So far in Minnesota, it has been confirmed in 44 counties. 19 counties have domestic or commercial flocks that have been affected. 29 counties have, it's been detected in wild birds. And then as far as the domestic or the commercial producers, it's been in 66 different commercial facilities. So far, there's no confirmed cases in Clay County. Our neighbors to the east and south, so Becker and Ottertail, have confirmed cases in commercial flocks, and then Wilkin to the south of us has a confirmed case in wild birds. It just has not been detected yet in Clay County. Chances are, with especially this time of year with all the migration going on, it's passing through our county. It's probably only a matter of time before we have a confirmed case in Clay County. So the response, just to kind of educate our public and the commissioners on the response from the state and the USDA, how they kind of deal with the domestic flocks is once it's identified in a domestic flock, they depopulate that flock, and that is done by staff from the USDA, the Minnesota Board of Animal Health, and then they also do employ some contractors to come and depopulate a flock. As far as like the smaller backyard flocks, like maybe some of the small communities allow backyard flocks, or just people that maybe have some, poultry for their own personal use, they are encouraged to, if they suspect that their flock is infected, they are requested to contact the Minnesota Board of Animal Health. They do have a hotline, and they will either ask them to have a vet come out and test their animals and instruct them on depopulating them if they're found to be positive, or if it's a large enough flock, they would send out staff from the Minnesota Department of Animal Health or the USDA.
So is there no cure for that, or you don't?
No, there is not. So there's different, it's kind of very similar to the flu in people. There's different strains, and the current strain right now that is really so hard on the commercial flocks in particular is a H5N1 strain. And I guess some of what I've learned in a lot of the briefings, they've been holding briefings a couple times a week that I've been a part of, is the weather pattern we're in right now is really, it's cold. Damp weather is really not good for viruses. And then birds, flocks of birds traveling through it, it spreads really quick, and the weather is just perfect for the spread of it. And then obviously when you have a concentration of birds, once it's in there, especially with the commercial, they just don't have the immune systems like a wild bird would. It's fatal. So they will come in and depopulate. The barn, for instance, would be sanitized, and it has to sit for a period of, I believe it's 28 days, and then USDA comes back in and inspects, confirms that the virus is no longer present, and then they can repopulate those flocks. As far as county emergency management, what we've been tasked with so far is to identify water sources. When they depopulate these flocks, the large commercial flocks, they use a lot of water in the depopulation process, up to 8,000 gallons per barn. So what I've done is identified, we do have a few commercial egg and poultry producers in the county, so I've identified they need clean, potable water in large amounts for the depopulation. So I've identified and reached out to several contacts and provided them with that. So at some point, if it is in Clay County and they need to do a depopulation, then they have that stuff kind of lined up already to take care of that. Just a couple, just kind of more for the public, some signs and symptoms and kind of what they should do. For domestic birds, if you have a small backyard flock or something like that, if you notice that they're not consuming water, if their water consumption drops off, if their heads are maybe drooping, and you just see a high death rate in your flock, chances are that's avian influenza. At that point, they should consult with their veterinarian or reach out to the Minnesota Board of Animal Health. Wild birds, especially with, it's really prevalent in waterfowl and raptors. So the larger birds, it's not so common in small, like songbirds, the backyard birds. But wild birds, if someone were to observe birds that are unable to fly, the drooping head, waterfowl that are maybe just swimming in circles, or birds that are having trouble standing, that would be signs. For wild birds, the point of contact would be the Minnesota Department of Natural Resources. They're the ones who would, if you were to contact them, they would advise you if you should just leave the bird, dispose of it, or if it's a large enough, I believe their threshold is if it's 5 birds or more that are maybe deceased in a certain area, they may come out, collect those, and test those. So that is on the county website. I do have under the news flash portion, I did post the latest press release from the Minnesota Board of Animal Health. They did extend, there is a ban in the state of Minnesota. They extended it. It was supposed to end at the end of this last month. They've extended it to June 1st, and that is on any sort of like 4-H, county fairs, any groupings of poultry. So where you'd bring poultry from different breeders or barns together. Sales of poultry are still okay, like at say Runnings, for instance, that is okay. Private sales from party to party are okay. They just don't want people bringing different flocks together. And then also in that press release that I posted there, they do have hyperlinks and the contact numbers for the Minnesota Board of Animal Health and the Department of Natural Resources.
Is there anything that people could do to prevent this to come into their flock?
So obviously the commercial producers, they have been in contact, and the Minnesota Board of Animal Health has contacted them, and they already have very tight biosecurity procedures in place at the commercial barns. As far as maybe small flock owners, people that maybe have a few like laying hens or something like that, probably some of the best things to do is try to keep wild birds out of there if possible. If they have netting stuff, anything they can do to keep wild birds out of their coops. Bird feeders, they did say it's not transmitted commonly through small songbirds, but they did recommend people either clean and sanitize their bird feeders or even remove them for the time being. This time of year, quite frankly, there's food for birds, so you're not hurting the population by removing bird feeders. Okay. So, any other questions? Okay, thank you.
Okay, thank you, Gabe. And with that, that, we'll go on to Rhonda and Kristen to fill vacancies at the social work position and behavioral health division. Good morning.
There we go. Okay, Kirsten and I are here to request permission to fill a vacancy in our substance use division. We have a social worker that has submitted her resignation. Her last day will be May 13th. This position has been about 50% conducting what's been known as Rule 25 alcohol assessments, alcohol and drug assessments, and about the other half doing treatment coordination. Starting July 1, Rule 25 assessments will no longer be completed in Minnesota. They're called comprehensive assessments. And you have to have an LADC in order to complete those assessments. The employee that's resigning was an LADC. We do have one other LADC with our agency. So we'd like to post this position. It'll be a social worker on our typical social worker grid, but with the requirement that they would have an LADC license. We're hopeful we can recruit with that certification so that we would be in a position to do comprehensive assessments and have a second person for backup starting July 1.
Mr. So is that why you're suggesting that this would not be a position that you'd ask for backfill? Is because
Correct. We don't have anybody in our current pool of employees that carry that certification, so it would be somebody outside of our existing staff.
What do you need to do to get this certification?
That's a Kirsten question.
The two staff that we currently have did go back to school. It's a 2-year program, and then they have to complete an internship as well. So it's pretty extensive to obtain their LADC license.
Okay.
And LADC stands for,
Licensed alcohol and drug counselor.
that's, so just checking them. Yep.
Okay. All right, any further questions?
I move approval.
Second.
You got a motion by Commissioner Campbell and second by Commissioner Kate. You have to change the sign around here. Okay. Any further discussion? All in favor?
Aye.
Aye.
Okay. I guess you got your position there.
Thank you.
You need backfill in that, or is that just going to be?
We didn't request backfill because we don't anticipate any internal eligibility for this position.
Very good.
Thank you.
Okay, thank you. And with that, we'll move on to Jessica Mickelson. We have our Proclamation for Foster Care Month and Child Care Providers Appreciation Day.
Good morning, Commissioners.
Good morning.
Did you have a copy of the proclamation?
Yes, we do. I mean, of the proclamation, is that what you're asking?
Yes.
Okay.
Would you like me to read it, or what?
Go ahead. Why don't you do that?
Okay, we'll start with the Foster Care Month proclamation. Whereas foster parents provide an invaluable service to the children, youth, and families of Clay County, and whereas foster parents give generously of themselves to provide nurturing, safety, guidance, hope, and love in a safe, secure, and stable home, and whereas foster parents recognize the opportunity to help a child or youth and their family in ways that will influence them and become a supportive and lasting presence for the remainder of their lives. And whereas foster, kinship, and adoptive families who open their homes and hearts to children whose families are in crisis play a vital role helping children and families heal and reconnect, thereby launching young people into successful adulthood. And whereas dedicated foster families frequently adopt foster children, resulting in a greater need for more foster families. And whereas May 2022 Foster Care Appreciation Month in Clay County is an appropriate opportunity to thank the families who embrace the challenges during COVID and the often thankless responsibility of providing a home and family to children in need of affection, love, and security, and to support the efforts of those who dedicate their time to children in foster care. Now therefore, the Clay County Board of Commissioners do hereby proclaim May as Foster Care Month in Clay County, and we call upon our citizens to recognize the contributions made by our foster families throughout our county. We also urge all citizens to come forward to do something positive that will change the life of a child and the youth in foster care. I did bring with me Gail Burnside. She is our child foster care licensor over in social services, and she just had an update to provide with you guys with what she's working on.
Good morning. I wanted to just, again, thank our foster parents. We appreciate them. They just do a wonderful job. The last few years with COVID, they have just exceeded our expectations, gone above and beyond, stayed home from work, just done so much for our kids with in-home schooling, just all the changes and doing not only for their own children at home, but then also for our foster kids that are placed in our home. Wanted to just give just some brief updates on our current foster parents, just some information for you all. We wanted to appreciate our foster parents, so we, Clay County, sent all of our foster homes a free day pass to the Red River Zoo. So they were going to be able to take their families, the adults and the kids, and go and spend a day at the zoo. So we sent that out to them this month. Currently, we have 60 licensed foster homes in Clay County. Of those 60 homes, we have 38 non-relative homes and then 22 relative homes that are taking in relative children. And approximately, we have 75 children in those homes. We have currently 15 homes in process of becoming licensed right now. So that's really great. We have done some various recruitment in the last couple years. Last year we worked with an advertising agency and we did some advertisements on the back of bathroom stalls in various businesses throughout Fargo and Moorhead. We continue to put recruitment and our need out there on social media. And this year we also went through an advertising agency and purchased a digital billboard on Highway 10, again, looking for homes. We have some upcoming recruitment events. In May, we're going to be doing a recruitment event with some conferences coming up. We have an event to appreciate foster parents in Fargo. We're doing a movie night at the Broadway Square in Fargo and doing an outdoor movie night where we're going to have vendors and food trucks and fun and games for kids. And so we're going to be being a part of that. Also Kids Fest in Moorhead, we're going to be a part of that as well. So just some fun upcoming things, hoping to recruit more foster parents. We're providing some free training coming up, CPR, first aid, getting our foster parent support group in place again since COVID. So really some opportunities and hopefully some support for our foster parents. So again, just want to appreciate all of them coming forward.
Can you just talk briefly about what qualifies you to be a foster parent? Do you need to be married, a certain age? What kind of housing should you have?
Yeah, absolutely. So to be a foster parent, you do not have to be married, single, married, in a relationship, same gender. Have to be 21 and older to be licensed. You can own a home, you can live in an apartment, you can rent. We are really open and will talk with whatever situation and work through that. But to qualify, you can have any of those things.
You just need to be a loving adult who wants to help take care of the kids.
Absolutely.
And can you also talk a little bit about the difference between respite care and foster care? Because we need both.
I have a lot of families that I license that when I license them, we really go through and talk about you don't have to be licensed for full-time care. If that's not what you see your family providing, we have lots of other ways families can help. And one of them is respite care. So we provide respite care to other foster families. Say somebody is going to be out of town and can't take kids with, or they need a break for a weekend. I have some families that just will provide respite care for that other foster family for 1 weekend a month or whatever is needed. We also provide respite care for kids that are at home with birth parents and need some support and maybe need a break. So we also have kiddos that are coming into our foster homes that are just at their birth parents' home or custodian's home that just need that support. So we have foster parents that help provide that support to them as well.
Yeah, I used to do respite care, and yep, that's what I did. 1 weekend a month for the same family, so we got to know that kiddo really, really well. It was easy, it was fun. It was really fun to get to know that kiddo. So if you think that, yeah, full-time care is not for you, I would encourage folks to consider respite care as well.
Okay, Commissioner Campbell?
Yeah, so in your report, you mentioned the 60 licensed foster families we have now in Clay County. What's really encouraging is the 15 new ones you're talking about that are in process. That's an amazing percentage of increase if they all follow through and are accepted through the process. So that's great news. And I know, Jessica, we worked with you through ARPA on some things for promoting both foster care and child care issues moving forward to help increase both of those. So this is encouraging to hear that you have that many new ones in line to come in. Did you mention anything about what we have for a current waiting list for foster families? I mean, the number of kids that might be waiting for foster care?
Well, our kiddos, we don't have any kids per se waiting to enter foster care. We have kiddos that are, again, we are sending them, in other counties for placement. So if our county homes are full or it's, maybe not a fit, then we reach out to other private agencies or other counties for assistance and utilizing their homes as well.
I probably said that wrong. I didn't, not necessarily a waiting list, but for however many new foster families we can have in, we will find the kids that are probably in need of that service.
Yes, yeah, it seems like as soon as I license a family, there is a child that comes in that I'm placing right away with that family.
On the families that have more than one child in their home, is that a brother-sister situation, or is that just from two different families?
I have both. I have some that take sibling groups, and that'll take a larger sibling group, and I have some that just take one, so it just depends. But the need is always there for large sibling groups. When we have a large sibling group enter care, we really try everything in our power to keep that sibling group together if possible, so we really weigh that out.
Okay. Is there any further questions?
Mr. Chair, I would move the proclamation.
Second.
Okay, we got a motion to approve the proclamation, and a second by Commissioner Kaley. Any further discussion? All in favor?
Aye.
Aye.
Thank you, Commissioners. I can go ahead and read the child care proclamation, if that's okay.
Okay, you can read now. I'll read the now and therefore when you get to that. Okay.
Okay, all right. We're a few days early, but May 6th, 2022 is the Child Care Appreciation Day, whereas Clay County and other organizations nationwide are recognizing child care providers on this day, and whereas over half the children under the age of 6 nationwide are estimated to spend some time in a non-parental care arrangement on a weekly basis, which provides critical enrichment opportunities and nurtures development for children of all backgrounds and is a vital building block of our county economy. And whereas the COVID-19 pandemic has created tremendous hardship for child care providers and the families of Clay County who depend on them, who have continued to meet the needs of families while risking their health and financial stability to remain open, and whereas our future depends on the quality of the early childhood experiences provided to young children today, support for high-quality childcare represents a worthy commitment to our children's future.
Now therefore, we, Clay County Board of Commissioners, hereby proclaim May 6, 2022 as Provider Appreciation Day in Clay County, Minnesota, and urge all citizens to recognize child care providers for their important work.
Mr. Chair, I would move the proclamation.
Second.
We got a motion by Commissioner Campbell, and a second by Commissioner Kaylee. Any further discussion?
I think our board certainly appreciates all the work that our foster care families and our child care providers do, and for those of you that work with them, thank you for that as well. And I just hope that through what we're able to do in ARPA, that we can even better improve the availability of child care services to our communities. So thank you for that.
Thank you. I do have a couple of brochures that were developed through some of the initiatives that we did through ARPA that I thought I would share with you guys, and I brought extra copies if you want to keep them as well. And Julie Clear and Karen Helm, our child care licensors, weren't able to be here with us today, but they did just give me a brief update on what they're working on. We currently have 134 child care homes in Clay County. They have 7 homes in application waiting to be licensed or going through that process. They are also, like similar to Gail, working on a lot of recruitment efforts. A lot of that was initiated through generous funding approved by this board and the ARPA committee, so we appreciate your support in that. And both of these brochures do kind of review what we've been working on. A lot of it is similar to what Gail mentioned: billboards, participation in community events. We've done a few interviews, and we're doing the bathroom wall marketing as well. And then these fabulous brochures, which I'll hand out. So thank you.
Okay, we got a motion, all in favor?
Aye.
Aye.
Opposed? Okay, motion passes, okay. Okay, thank you, Jessica and Gail. Now, Michelle, annual report for the local advisory council for children's mental health. Good morning, Michelle.
Can you hear me now?
Yeah, go ahead.
Thing. Yep. My name is Jeremy Pratch. I work at Lakeland Mental Health, and I coordinate children's services and know a lot about Lakeland Mental Health. So,
Jeremy's been on the LAC board for a long time, so I asked him to be here to help give some information. So we just want to thank you guys again for letting us come and talk about what the work that the Children's LAC board has been working on this past year. As you know, May is Mental Health Awareness Month. The LAC has had some big shoes to fill. Carolyn Sternad, as you know, retired last year. We've really been working hard to kind of find our footing and how we're going to move our group forward. When you lose a leader for so many years, it's kind of hard to know, like, where do we want to go in the future? What do we want to define this group as? And we've really seen some difficulty in the last year as far as membership and people coming to meetings, and so we've had some good discussions in regards to how can we get people back to the table. But I believe you have our packet in there. I'll just kind of talk about some of the projects that we did work on this past year. We printed and distributed more of the Who Do You Call brochures and pamphlets, and the parenting tips wallet cards throughout the community. I believe we developed those last year and felt that that was a good thing to distribute again, so we continued with that project. We did successfully transition duties due to Carolyn Sternad's retirement. We did have a chair elected, was Megan Weiland, but unfortunately she resigned, and so was elected the chair last month. So I'm just trying to patch it together, what we can do. But we really have talked a lot about exploring the LAC duties and membership to increase participation. You know, I think COVID really did a number on our meetings, on our community meetings. We don't have any consumers or parents sitting on our board right now. We've had some good discussions about how we can make more of an effort to get people to come and sit on our board, and I think we're making some gains, but I think it's just going to take some time. Last year, we purchased kites to give the kids who attended Kids Fest. We did revamp the annual survey. We give out an annual survey, which we'll kind of talk about a little bit, and worked on developing ways to make it more accessible to people. I know Commissioner Cayley really helped with that by developing a QR code for people to be able to access from their phones. And then as far as for the mental health awareness activities, a billboard advertisement will be running the first week in May. I'm not going to go into the parent survey too much. You can review the information in your packet. We had a really low turnout, unfortunately. I think we had a total of 5 people respond. We have had discussions since then, though, about how we can get that survey out to more people, maybe get it out earlier in the year before it's due. I think we were kind of crunched for some time and maybe didn't have access to as many people. So you can review what those survey results were, but I won't go into those too much, but I'll let Jeremy kind of talk about the professional survey results.
So on some of the, in the past, a lot of these barriers have been very similar, and we've been working a lot on them. Then COVID kind of came through, and then it actually helped out a lot because we were doing a lot of stuff by Zoom. The buses were providing free busing at the time, which transportation is one of our biggest issues, but it's an achievable goal. Some of our barriers are insurance, transportation, long wait lists, interpreters, and services not available, but all of those are achievable. We can improve those. Transportation with Lakeland and any other service providers in the community, they provide transportation for their clients. A lot of times in the kids' world, we provide transportation to the parents, siblings. If we have to get a kid to an appointment, the whole family will come with if it makes it better for the professional to come. Insurance, we have a program that we run through Clay County Social Services where I myself help some of the families SMIRT. It's state medical review team, so we help some of these people and families that do not have insurance. We can help them through a list of criteria that can help people get on Minnesota MA or a PMAP plan, which really helps with any mental health service. Transportation, there's options for free transportation. Services are nil to none. And some of the medications they're very expensive, so you get them on the right insurance, it definitely helps. The long wait list, that's a tough one because, right now, some of the service providers are understaffed. Some people leave, we have the same share that people are in and out, but we try to fill them as fast as we can. And I know with the services that we have, I will watch other people's caseloads. I will watch other people's just to make sure that we can keep these kids coming in and some of their families coming in. Interpreters, we do offer interpreter services either by phone, so that is an achievable goal. If you come in, we will definitely get an interpreter for you at most of the agencies in the community. And one of the big ones, I do kind of agree, if your family is having a crisis right now, it is really hard to provide that service as quickly because there's criteria we need to take care of before we can actually see a family. But once again, through Clay County, we provide a fast track case management, which we can take some of these families in and try to help them right away at the beginning, and then I will continue with these families throughout their service providers to make sure they get to where they gotta go. It doesn't have to be within our agency. I will find other agencies to find. West Central's been a huge sport because we use them, we use them a lot when some of our kids, we know where they're at, so they're easy to find, and a lot of our kids will come through their program. So a lot of the barriers we were working on, and I honestly feel that we're making progress. It's just every time we think we have it, something comes up we can't control. But ever since, with COVID, we are definitely making progress in these areas. And I feel that next year we might have the same conversation, but I know it'll be, in certain areas, we'll be getting better, so.
So some of the successes that the council would like to report on are that school-based mental health services are available in 4 of the 5 county public schools. Collaboration among LAC partners occurs as a result of conversations that arise at council meetings. Networking at meetings continues to be the most popular agenda item. The LAC donated to annual Kids Fest, Resource Fair, and Family Event. We went back to in-person meetings, which was really exciting. And Caravel Autism Health joined the LAC. So as far as recommendations that we have for the board, COVID continues to heighten the awareness of mental health. While not every child will be diagnosed with a mental health disorder due to COVID, they will struggle with mental health affecting their overall health. Systems are seeing an increased need for mental health services at the early intervention level.
Wait times for Rule 79 case management need to be reduced when possible, which we are working on that. There is a case management wait list at the time for medical assistant funding. Applications for case management we'll use their insurances. They'll be placed in a process through the gatekeepers, and then we will get those children through as quickly as we can.
Mental health agencies are doing their best at increasing staff. However, the demand for mental health services exceeds available providers. For some positions, mental health agencies are now competing for staff with fast food restaurants due to increased wages and benefits being offered to employees in that industry.
We need to continue to bring awareness to the shortages of pediatric psychiatrists, therapists, case managers, foster care providers, autism providers, and respite care providers in our area.
Continue to fund and support important social services programs such as respite care, collaborative intensive bridging services, and case management.
Continue to promote the mobile crisis response program to ensure that families are aware of the services in the area and its benefits and how to be accessed.
Continue to address the transportation challenges of the community.
And this is a big one, increase awareness of mental health jobs to foster more young adults into our field to increase providers. We have seen a trend in providers leaving the field and choosing other areas or having retirement or burnout.
And then our work plan is also attached for your review. And I believe there is a proclamation in the in your packet as well for Mental Health Month.
Go ahead.
I can read that one. Whereas mental health is essential for everyone's overall health and well-being, and whereas all Americans experience times of difficulty and stress in their lives, and whereas identifying and addressing mental health concerns earlier improves the quality of life for adults and children and their chance to succeed, and whereas Clay County has made a commitment to community-based systems of mental health care for all residents and has appointed local mental health advisory councils for adults and children, and whereas each business, school, government agency, healthcare provider, organization, and citizen share the responsibility to address mental health concerns and promote mental health wellness and prevention efforts. Therefore, we, the Clay County Board of Commissioners, proclaim May 2022 as Mental Health Month, and specifically May 5th as Children's Mental Health Day in Clay County, Minnesota. As Commissioners of Clay County, we call upon the citizens, government agencies, public and private institutions, businesses, and schools in Clay County to recommit to our community to increasing awareness and understanding of mental health, the steps our citizens can take to protect their mental health, and the need for appropriate and accessible services for all people with mental health conditions. Adopted the 3rd day of May.
Move for approval.
Second.
Okay, we got a motion by Commissioner Dave and Commissioner Campbell seconded. Any further discussion? All in favor?
Aye.
We did have some discussion, excuse me.
Well, I just want to say thank you for stepping in to chair that LAC. There's been really great positive change already, fantastic discussions. You didn't have a lot to work with for this report, and yet you put together an incredible report on what's happened in the last year and the challenges and the successes. So thank you so much, Michelle, for all of your work on that. And I know that, yeah, we're just gonna, next year it's gonna look totally different because of the steps that we're taking forward with this group and the broader conversation that we'll be having about mental health care for our children in the area. Thank you.
I guess I always would like to thank you. When we look at, a lot of times when we have reports, we say, well, because of COVID-19, you know, we're working with COVID-19. It's been here now for 2 years or so, so we've got to get over that reason that we can't do things. We can do things, and you are, and I appreciate that. Thank you very much. Yes, Commissioner.
Thank you. I look at these surveys and I look at the results and I look at the recommendations, and it seems to me that there's always some of the same things that come to the top of the list year after year after year. Going to Commissioner Cayley's comments, I'm hopeful that that we can continue, first off, to address the stigma of mental illness. I say that all the time, but I think that's there's probably more people that have some form of it than not. Nobody should be embarrassed by that, and nobody should be afraid to seek help if you have it. There's a little frustration that I see right now, because through our process that we have here on the county board, we have several of us that might be on different committees, and some of them deal with mental health issues in different ways. And what I'm trying to speak to here is the communication level that's important, so that all of these different groups that get together to discuss these can hear some of the same stories. When we have people from law enforcement talking to us about the mobile mental health concerns and the issues there, we need to make sure that all of the other groups that are also working on this understand the same concerns. And if you really want to get to a process of fixing them, you gotta have everybody working together and understanding the issues. I have a concern in some ways where, and I'm using the mobile mental health as an example, because that issue's been raised recently, and it's important. We have commissioners that serve on the board of Lakeland Mental Health, and we have others that don't serve on there but deal with the mental health issues in different ways. And we really need to, I think we as a board might have to relook at some of those issues to make sure that everybody is aware of all the concerns that go on, instead of just hearing one part that maybe is more in line with the committee you serve on, but you don't hear the rest of it. So I think that's going to fall on us to make some changes there moving forward. And I too am thankful for your willingness to step up and chairing this group. And we need to try to, in a lot of things, we all have our bucket lists of things we want to accomplish. And I think we need to start being able to check off more things here. So we'll work on that, and we can't do it without the expertise of the boots on the ground who see the issues more so than we do. And so we're thankful for your report. And
Thanks for those comments. Commissioner Edminger.
Yeah, I'll jump in here. I was law enforcement officer for 40 years. I worked with law enforcement response to mental health issues in a large metropolitan area. We created a stabilization unit. We did a lot of good things, and I watched those good efforts made a couple decades ago disintegrate for lack of funding. Once the SAMHSA grant gave out, the stabilization unit and the training of CIT officers dissipated into nothing. Now that I'm an elected official, that's something that's near and dear to my heart. And unfortunately, because of some very tragic events all across the country, we're finding out that the decades-old practice of stigmatizing mental health and criminalizing the manifestation of it and using our correctional facilities as holding pens and warehouses for people who are uninsured and have mental health crisis has got to end. There's a lot of good intended legislation and a lot of good legislation that's happening, but we're going to have to get together on this, or we're going to have to quit operating in silos. And that's one of the problems we're facing here as a commission, is we all have our silo, and they're well intended. But we are moving into an era where we're going to have to integrate mental health response with every other crisis response we have. If you have a medical crisis, we've learned decades ago to have ambulance service, have emergent care, and have good, consistent treatment. as well as preventative medicine. The same models and the same efforts to fund have got to go into this. On a very local basis, a lot of good effort has gone into our mobile mental health response, into the systems we have, but it's not enough, and it's not responding to the changes that society is expressing. They expect us to be able to come up with a 211 or 989 system, whatever you want to call it, where people can call when they have emergent mental health issues, and somebody besides a guy with a gun and 40 hours of training in mental health shows up. And we're going to get there. But this is something we're going to have to approach as a team, and there's going to have to be willingness to change what we have now to meet the responses, the expectations, and the realities of the crisis we're facing. And I think this commission is, every one of us, we come at it from different angles. God bless that. God help us if a cop is going to dictate how we approach this, or a social worker is going to dictate how we approach this. We got to work together and figure out how we're all going to make it work. And I think this is a good opportunity, and this is a good time for us to sit down and realize that. And what you folks have done, our kids are at stake. And if we don't address it, and their parents and the adults that are in their lives and what they see every day, they're not going to feel like it's accessible to them. And our kids right now have more issues, more pressures, and more crises put on them in the last 2 years with COVID and all the other things that are impacting on them. I think it's time we start taking it seriously. And we start joining and taking this in unison, move together on this. And I think Mental Health Month is a good time to talk about it. And I appreciate my colleagues bringing it up and talking about it. So thank you for your efforts, and understand that we're committed to this. And there's a lot of people and a lot of disciplines out there that are behind you. And we're going to get progress. Thank you.
Thank you for those comments, too. And
Can I add one more thing?
yes.
What I want the public to hear from this conversation is that all of our commissioners, with their various backgrounds, have a deep commitment to making sure that our citizens, no matter how old you are, birth through the end of your life, are getting the care that you need, that you can be home, that you can stay in our county and receive the services that you need here. And we want to take steps in that direction to achieving better outcomes for all of you. I did want to ask a quick question, though, on that. Residential treatment for kids. I think do we have 3 facilities in the state currently, or what is that climate looking like? And can our kids with the biggest needs stay close to home, or are they going far away from their families?
You know, as far as the number of residential treatment facilities in Minnesota, I don't know the number to that. There are a number. I know there's, I don't know if maybe, the psychiatric residential treatment facilities that step down from hospital, I think that might be around that 3 number. When a family comes to us and saying, we believe that this child needs to be placed out of the home to receive residential care, we go through a very stringent process of staffing it with a team, a multidisciplinary team. We want kids to stay in their home. We know outcomes are better for children when they're treated in their community, at home, with their parents. So placing children out of their home into a residential setting is the last thing that we want to do. Unfortunately, there are times when kids' needs are greater than what they can be served in their home or community, and then that's when that happens. But with our Collaborative Intensive Bridging Services program that we received through the SAMHSA grant, that is a service that we like to implement when at all possible, where the children remains in the home. There's several phases to it, not to get into too many details, but we've partnered with West Central as that phase 2, which is a less than 30-day placement, where the kids really work intensively on the behaviors that are leading to their out-of-home placement. And we've seen some real success with that. So I feel like I talked a lot, and I don't know if I answered your question, but we do want to keep children in their community when at all possible.
But with, I've done this 20-plus years now, and every year that I do this, I learn something new on how to help kids and how to help families. So what I brought in when I graduated college to where I'm at now, I'm not even dealing with some of the same issues. It's moved so forward. But like Michelle was saying, everything we do in the mental health at Lakeland, as well as with the county, we try to keep them here. And we try to push as many resources as we possibly can. And we have agencies that are there to help. Granted, they're overworked at sometimes, but right now we're finding the people to fill those spots to lessen our treatment, because there's nothing worse on a February driving to Girard and back when it's blizzarding to see our kids, because that's our commitment that we have. We'll go to Austin, Minnesota and back in the same day to make sure we hit those progress meetings, make sure we talk about their medications and how they can be better. So the commitment is there. We just have to find a little bit more places to help some of our kids and adults.
I just want to, one last thing, if we make a 911 call because we might have somebody who's maybe having heart issues or something, and they respond immediately and they get them in, and if they need be, they get into surgery and they can hopefully fix that issue. And it seems to me, based on what I'm hearing, sometimes if the call comes in with a mental health issue, it's, okay, well, we have to see where we have room for you. And that, to me, that's a crisis, and a significant one. If you got somebody who's in a state of mind that they don't know that they want to be around anymore, I don't know that you have a lot of time. And you can't be looking for places for them to go. You need to help them right away. And that's where I don't know that we as a community, or we as a state, we as a nation are prepared for that, to improve that, but we need to. And, we hear locally and of families that suffer because of that right now, and we need to do better. Thank you.
Well, Michelle, as you can see, you got our support for what you do, and I really want to thank you for what you are doing and continue on. We have our confidence in you, and hopefully things will keep on working for you. Thank you.
Appreciate your time.
And continuing on adult mental health, we got Allison Woolbeck coming forth on the local advisory council.
Good morning. My name is Allison Wolbeck. I'm currently co-chair of the Clay County Adult Mental Health Local Advisory Council, and I'd like to introduce my other co-chair who needs to turn her mic on.
That's on.
Nope, it needs to be green.
Oh, it's not. Oh.
There you go.
Thank you.
I'm Ann Burrell, and I am new at this, so patience.
And I also have Leslie Flick from, did I get that right? Good. What? Funk, Leslie Funk from Lakeland Mental Health, who's also here with us today. I just want to thank all the commissioners for the investments that you've put into the Clay County Adult Mental Health Local Advisory Council. We appreciate your ongoing support of the work we do. COVID, of course, threw a wrench in things, and we ended up having to meet via Zoom, which due to different ability levels on our council and the constraints of technology was not always easy, but we are glad to finally be meeting again. And we're excited to move forward. Through the funding the county has provided for the LAC, we will continue to provide ongoing education to mental health and mental health services across the community. Consumer and family members of the LAC continue to receive stipends for to participate in community events and mental health projects, and that has allowed them to have a greater understanding of ongoing mental health needs of the larger community. We will move to page 4 and go right into our recommendations and our concerns. And I'll start off with Ann. She will start off with housing support.
This has been an ongoing concern, and you mentioned that yourselves. You realize that a lot of these problems are just on a continuing basis. The housing, we know there's efforts that have been made, but there still remain needs because so many of them are out of reach for people financially. And there's resources, but again, often the resources don't come up to what is actually needed and could be helped, hopefully. One important fact that is in your information, I think, is that half of all renters often are burdened with paying that rent, which leads to stress, which, if you already have a mental illness, is compounding that stress. So our recommendations are to encourage and approve the development of new affordable, the key word, affordable rental options, revise existing rental rehabilitation programs, and encourage private market owners to keep rental units available to low-income renters. Improve protections for renters by identifying and cracking down on predatory rental practices, including excessive evictions and poor condition of rental units. Provide dependable and consistent funding for social services that help maintain stable homes and identify gaps for adults with a lived experience of mental illness. Thank you.
Next, we have to speak about the Crisis Stabilization Unit, Leslie Funk. She will get into depth about some of the issues that lie there.
I am Leslie, and I'm with the Mobile Mental Health Crisis Response Program here in Clay County. And one of the biggest issues that we have is when we have an adult who does not feel safe to stay home, but does not feel that hospitalization is needed. We have no crisis beds for them. The one crisis unit that we have here in town, they don't do intake on weekends. I spent Friday morning through Monday afternoon on the call off and on with the Gull Harbor crisis unit. They had no beds. They didn't have anybody to do intake on the weekends and nobody after 4 p.m. So we end up having to send our clients in Clay County all the way to Detroit Lakes or Fergus Falls, and then trying to find transportation to specific places like Detroit Lakes, which doesn't do transportation. So a big issue is getting the funding or having available beds and having them do actual crisis intake where it's 24 hours a day, every day of the week, instead of just 8 a.m. to 4 p.m. Monday through Friday.
Are there resources on the west side of the river that we would have access to in Clay County?
Typically, Fargo won't take clients if it's like a crisis stabilization unit. They won't take people out of the state.
The reason being funding, or?
I believe so. I believe it's funding. I know we can't take anybody from Fargo because of funding, insurance-wise, and it's paid all by grants. So.
Thank you. Next, unfortunately, our individual who wrote the last one had a prior commitment and was unable to stay. So I will try to muddle through and hopefully explain it as good as she can. Clay County, according to the Clay County website, 13.4% of its senior citizen population with mental illness utilize the senior linkage line of the Minnesota Department of Aging. According to the Minnesota Demographic Center of the Department of Administration, citizens over 65 could double by 2030. In the 2000 Minnesota Department of Aging report, Reshaping Long-Term Care in Minnesota, it emphasizes the reduction of nursing homes and increase of elders at home. With more senior citizens living independently at home, Loss of problem resolution increases mental health issues. These issues could be minimized with the following resolutions. Funding a task force of public and non-public members to be formed to evaluate methods. Expand senior linkage services to family caregivers by internet and hard copy. Increase usage of assistive devices and technology skills for elderly consumers. Provide training, education, compensation, and respite services for family caregivers. The results of the task force would be beneficial to elders, families, agencies, and businesses. I know that the individual who wrote this shared an experience of an elderly individual who lived in a care facility, who was experiencing hallucinations. And the individuals in charge of that facility did not know what to do, how to handle the situation. And so definitely further education of individuals in charge of different senior living situations definitely needs to occur to help mediate these issues.
Okay.
Any questions so far?
Go ahead.
Okay, I would like to ask Tamara Vance. She is a woman who is on the County Adult Mental Health Local Advisory Council, and she has a little bit to share with you today.
Good morning, everybody. My name is Tamara Vance. I've lived in California for 42 years, and I've been up here for 19. That should tell you my age. I've never really known how to cope with people or anything in situations in California. I was never diagnosed with depression or anxiety until I came up here, and without Lakeland Mental Health, A Place for Hope, places like Solutions or CCRI or any of the other ones that can help people like me. I came up on a promised job, and the lady wrote bad checks, and I lost my job. I was homeless, jobless, everything. So I moved into churches, and then I became a member of A Place for Hope. At that time it was a Social Connection. And then I became a member of the LAC, which has really helped me to understand certain mental health problems, issues, places where people can go to. I lost my train of thought. See, that's why I have notes. Let me go back. Anyway, without places like these, I would be under the railroad tracks, literally. I would not want to live. I would not want to be here if it wasn't for the club, my friends, and A Place for Hope. That's really helped me. I've never had a place to live more than 3 years in my life. I've been in a house now for 9 years, thanks to mental health issues, pills, medication that really helps me get through things. So I'm here to basically tell you and to talk about people that aren't here, people like me that don't have a voice, people don't want to listen to them because they do have that stigma of mental illness. They don't really care about certain people with mental illness until I found a place to come and enjoy myself, and that's about all I got to say. I'm starting to cry.
Our final piece is approval of our member list, which is on page 5. We request approval from the county board.
I'd like to move approval of the local advisory council member list.
We've got a
Second.
motion for approval of the member advisory council membership list.
Second.
Second by Councilman Evinger. Any further discussion on that? All in favor?
Aye.
Aye.
Opposed? Okay,
Thank you very much.
all right, thank you.
Can I have a couple comments before you walk away?
Me.
It has been an honor to be a part of this group. Allison and Ann, you've done a fantastic job. Tamara, you are so brave. Thank you for coming and for sharing. Your story is really important. And it's proof that when we invest in these services, in these places, and when we listen, and when we open our hearts and our homes, we all do better. And I'm so glad you're here with us today, Tamara. I'm so glad that you are in stable housing and not searching for where you're going to sleep tonight. I don't like trains either. So thank you for the continued work, Allison, for your years of investment in trying to move adult mental health forward in our community. There has been movement forward, and you've been a good part of that. Thank you so much for being here today.
Thanks.
Thank you, Allison. It's been good to hear this morning from the different parts of different organizations that are really helping Clay County out to continue on their good work. Appreciate your help.
Thank you.
And now we'll go on to a report from a Place of Hope Recovery and Wellness Center from Daryl Vosick.
Good morning, Commissioners.
Good morning.
Before I get into my report, I just listening to these stories. I've been very involved with First Link. In fact, I started with Community Resources back in 1979. So it's just a reminder that anybody that has mental health issues and needs help immediately dial 211 or 701-235-SEEK. And there's people that are professionally trained there to help you through your crisis. And I have been there with some of the calls, and it is very mind-boggling or stressful to listen to those, to try to talk people down from killing themselves. So that's just my 2 cents worth on that. Some of the highlights for us at A Place for Hope this year, we really got into our food bank area when we were closed with COVID. Many of our members become involved. We distributed close to 322,000 pounds of food, and that was not even the whole year because we didn't start right at the beginning. So this provided food to 5,738 families, or a little over 13,600 individuals. We did end up with 8 new members on our mental health side. And in addition to that, I cook meals every day for our members and volunteers and provided meals to 2,227 individuals. We did add a couple new board members this year. One was from A Place for Hope as a community member, and then another, Ryan Gellner, he's a senior vice president of IT from Gate City Bank. So he's been a great addition to our staff. We had 469 member visits this last year, 5,164 guest visits, and we were open 208 days. We also logged just about 6,700 volunteer hours, so that's what keeps our place going. We did get the purchase and installation complete of our walk-in freezers and coolers, our central air and furnace, and all the electrical work that was needed for our new space that we got for our food shelf area, which was graciously been donated by Agassiz Valley property owners. So we're only having to pay for basic our heat, electricity in that area. Just a few stats of where we are this year. We've had over just about 2,700 people attending already this year. And in turn, that's just thousands of individuals. We've added 7 new members to the mental health side. We've been open 73 days. And just because we've had such a large increase of people coming in looking for food, we've been open the last 3 Saturdays to try it, to see how it goes. And every one of our spaces is filled up. To come in to get food, you have to call in and make an appointment. We do 15-minute intervals where we take them through one-on-one so they can pick out the actual food they want rather than just hand them a box. We're also recording ethnicities right now. We're working closely with the Great Plains Food Bank, trying to figure out where everybody's coming from and what kind of food they actually do need and want. So we're in the process of doing that. We've been doing that for the last like 3-4 weeks. So we're going to report these statistics to the Great Plains Food Bank as well as to the state of Minnesota. So far this year, we've given out over 132,000 pounds of food, and we've had about 2,600 volunteer hours. Commissioner Cayley did come over and visit with us. As we're kind of in a dilemma right now, the Great Plains Food Bank does not have as much food available as they had in the past. We're having to purchase it. We really don't have the funds to purchase it, so we're trying to figure out ways to get additional funding. We're looking at grants. Reached out to Rory Beal to see if there might be some ARPA money available for that. And we were looking somewhere in the area of maybe like $1,000 to $1,500 a month to help us support what we're getting from the Great Plains Food Bank that we have had and are not getting right now. So that's what we're doing on that area. Commissioner Cayley also recommended that we maybe get an interpreter, and we've done that. 1 day a week, we have an interpreter coming in because we're having a hard time understanding some of the individuals coming in. So that's kind of what we're up to. And I don't know if anybody has any questions.
I guess I have a question as far as you say you don't have the available funding. So what happens when you don't have available funding?
We just cut back, like days that we have abundance of meat, we give 3 to 4 meat items plus all the other stuff. We also have canned goods and whatever, so we cut back, we kind of give and take what we have. I did have a meeting with the Great Plains Food Bank last week, and we talked about the barrels that are in all the grocery stores, and they said that they could direct some of those to us, so that would help us also in that area, because a lot of that food right now is going to the emergency food pantry, and they seem to have quite a bit, but they only allow individuals to come in there once every 2 months, where we do allow our people coming in once a week if they need it. We did have, the Sabin Food Bank reached out to me to see if we would be willing to take their folks on, and we will, of course, because many of the individuals that live there are too proud to come in. So when they're coming into our area, they would just fit in with everybody else and they wouldn't have a stigma tied to them.
You have to go through certain qualifications to qualify to get food? Or
It's just 300% of the poverty level.
Okay.
If somebody wanted to donate specifically to your organization, either food or cash, is there a mechanism you've got set up for that to happen?
Well, we can take cash donations right on our website. We finally got our new website up. We've actually had some come in. Commissioner Cayley also set up a food collection at the library and food donations. We've picked some up from there. That's been very good. We have gotten a few donations in on our website, so it is working. We've had a few unfortunate deaths in our community, and we've gotten donations that way through our website too.
Yeah, Commissioner Cayley already reached out and we've donated to the library, so that got to you, but just give your website for those who may be interested.
Well, it's AP4H.
.org.
It just went blank. AP4H.
If I could just insert one more thing, that food drive at the Moorhead Library is hosting that, and so donations can be dropped off there through the 7th. And for any donations, that can be cash or check, there is an anonymous donor who is matching those up to $2,000. So if you would like to earmark something for A Place for Hope, you could write that as a check and drop that off at the Moorhead Library, and we'll make sure that that gets matched to double your funds going to this organization. And I'm looking up your website for you real quick.
I know, it just went blank.
It's a place for the number 4 hope.org. And the donate link is right on the upper right-hand corner of the website.
Thank you.
All right.
Just some final comments about A Place for Hope. A Place for Hope is a place where you belong. A Place for Hope is a place where you are important, where your identity matters. I love the steps that you are taking right now to ensure that if there are specific foods that different ethnic groups in the community are needing and wanting, that we're identifying that and that you are seeking to serve the specific needs of those folks. So A Place for Hope is a place where you are valued. And I think we heard that testimonial earlier when Tamara was sharing her story. And I know that many members of the Adult Mental Health Local Advisory Council are members at A Place for Hope, and they just find it an incredible place that has helped them on their journey towards wellness. So thank you, Daryl, for working 90 hours a week, or I know your schedule is crazy, but you are so invested in our community and helping everybody to thrive that comes through your doors.
Okay. Thank you.
Thank you very much for coming forward with your report. And with that, we'll take a short break here for 5 minutes, and we'll be right back.
Here we go. All right, everyone, we're back from our break. Thank you to Commissioner Gross for overseeing the first half of this meeting. I was fortunate enough to join Congresswoman Michelle Fischbach and city and other organizations to walk through the Moorhead Career Academy, such a vital piece to addressing so many different levels of issues from education to workforce, something our community can definitely be proud of. So thank you for holding down the fort, Francis. All right, the next item, number 10, correct, is a request for approval to send a letter of support for federal capital project funds for the Lake Agassiz Regional Library. Steve.
Good morning, Madam Chair, Commissioners. Before you, again, for your consideration is this letter of support. I think this past week, Executive Director of the Lake Agassiz Regional Library, Liz Lynch, reached out to our region's county administrators and city managers in hopes of providing a letter of support to Governor Walz and his administration to identify that libraries are a priority in the state of Minnesota, and they're important, provide an important service for all of us. To open up some additional federal funding for projects in the state of Minnesota. In order to do that, the state of Minnesota has to list the libraries as a priority when these funds can be utilized for different renovations within and/or construction for those needs. If you take a look at the letter, the average library within the state of Minnesota is 52 years old. I believe our library is older than that. And again, there's some additional needs. As this board certainly aware, you provide some ongoing financial support through our levy to the library. And as we heard from Ms. Lynch this year, the library utilized right around $100,000 of their reserves to reach their budget this year and to limit the additional dollars they needed from its members. And so when you look at that and you look at the needs that they have within our facilities, it's evident that they don't have that money built in, and so these funding dollars could certainly have a positive impact on our libraries. With that, I would yield for any questions.
Thank you. I know there's several questions on here. Just a point of clarification. On here, it says a letter of support for federal. Are we writing the letter to the feds or to?
So the money comes from the federal government, but it is a pass-through through the state. And so the state has to make the request to the federal government for it to happen.
Thank you. Commissioner Campbell?
Thank you. In reading this, I guess the very first sentence, it says, "I am writing today on behalf of cities and libraries." I wonder if we shouldn't start off by saying, "I am writing today on behalf of Clay County, our citizens and libraries."
Makes sense.
I think we should be included in that. You are our county administrator.
Commissioner Ebinger?
Yes, I'm on the board representing the county at Lake Agassiz Library, and I'm going to pull this figure out of the air, and perhaps Commissioner Cayley can correct me if I'm wrong. I believe statewide there's $90 million worth of improvements and repairs and renovations needed in local libraries. Okay, it is. I scanned for it.
The third bullet point.
Okay, there we go. What it doesn't say is $1 million is in the governor's budget for those needs, leaving $89 million unaddressed. And these are repairs that are critical. I'm not talking about improvements. I'm talking about keeping the roof from leaking, toilets that flush, handicap access to bring it into federal compliance. These are critical needs. So I strongly endorse this. There's also some bonding issues right now that are before the legislature that we spoke to briefly when we visited last week. But there's some definite funding needs in our library statewide, and they meet critical needs in access to the internet, jobs, training, all sorts of things that some of the most vulnerable people in our community, they are the access, a gateway that they have to get into the services. So strongly recommend we go forward with this.
Commissioner Cayley?
So just to be fully transparent with the public, yes, I am also an employee of Lake Agassiz Regional Library, which is a 7-county library system. And I did talk with Mr. Melton, our attorney, to see what I could say and couldn't say as a part of this conversation. And my understanding is I can provide information, answer questions, be a part of the conversation. But I do intend to recuse myself from the vote on this since I am employee. Is that correct?
I think that Commissioner Cayley and I talked about it. I would recommend to her that just remove any idea of a possible conflict of interest. Best recommendation would be not to provide a vote, but certainly hearing from her and listening to her expertise is a much needed voice and very much within what she could provide. I mean, and I think ultimately if she ultimately wanted to vote, it would not be, I mean, this is not a personal thing to her that she's benefiting from necessarily, but I recommend it to her as a best thing. Best practice would be just pull herself away from that so it doesn't have any other appearance. So ultimately it's up to her, but I would recommend not voting is probably the best thing. But certainly would want to hear from her if she wants to offer up information.
Thank you for that. Yeah, to piggyback off of what Commissioner Ebinger just said, the bullet point 3, the 40 libraries with urgent needs. There are 365 libraries in the state, public libraries in the state of Minnesota, and those 40 libraries, those are just the absolute necessity, urgent needs. If we were to look at the total needs for the state, the number would be astronomical. Usually the governor has, I think, a little over $2 million in his budget for these things, and for some reason in this surplus year, he dropped it down to $1 million. I can tell you that one of our libraries recently got quotes for a bathroom project to make it ADA compliant. It's, something we absolutely need to do. And they are not able to go forth with those bids right now because it was well over $100,000 for that particular bathroom project. So now copy and paste that to the 23 other locations just in the Lake Agassiz system. There's huge needs in our state. So this is much needed. And our libraries are an incredibly important point of infrastructure in connecting citizens to the resources that they need. One of those being broadband for their businesses, to apply for Social Security, to apply for jobs, even just to communicate with their families. Yeah, happy to answer any other questions if there's any more on this.
Thank you. Commissioner Campbell?
I just want to follow up again on the letter itself, and you know, when we're raising some issues with the state and we send a letter to the governor, I'm just wondering why we wouldn't CC our local legislatures on this, to keep them aware of the same thing that we're talking about. I would just suggest that we would add that. I know this might be sort of a boilerplate type of a letter that may be going around to all counties to be able to do. I get that, but I think we should be CCing our local legislatures.
I can add that. Commissioner Campbell.
Thank you, Steve. I just want to comment on the timing of this. How much has already been allocated and gone through tax committees or hearings? Has all of this had hearings on it? Certainly, we're towards the final finish line of session. Just don't want this to be too late. If it is too late for certain parts, does it have more of an impact if we're addressing other pieces?
I probably don't know the specific answer to that, other than when I talked with Ms. Lynch at the end of last week when the request came forward, that she felt Tuesday would be an adequate time to have it signed by.
And then the final question I have, in terms of the city of Moorhead going out for a vote to address their library needs, is this in any way endorsing that project, or is it specifically projects on the existing?
Just existing.
Okay. Questions?
Going to Commissioner Moser, going to your question, I probably think from the standpoint of where things are in tax committee and everything, this is falling late. There's no question about it. But that doesn't mean to say that as the bonding thing moves forward, that's always typically the last thing the legislature does, is the bonding that goes on for the year. And also, maybe there's some potential when they consider the $9 billion surplus that they have going on. There might be, at least there could be developing a list that could benefit from that from a infrastructure improvement standpoint, which certainly the state needs in a lot of areas. So I think the letter is okay from that standpoint.
Probably just to clarify where my point of questioning came is, we have been advocating at the Capitol for a significant amount of issues, and know that as we get down towards the wire, it's important that our message is as concise and clear as possible. And I have no problem sending a letter in support for these needs, but also think it's important that we do equally the same to the projects and priorities that we've talked about and lobbied for. If somebody, for whatever reason, hasn't been paying a whole lot of attention in St. Paul, not us, but in St. Paul for whatever reason, to get this statement from Clay County is perceived as this is Clay County's #1 priority.
I'll make a motion that we move ahead with the letter and send it.
We have a motion by Commissioner Gross to send the letter of support, a second by Commissioner Ebbinger. Are there any further discussion?
You raise a good point about that issue, but I think, and that's why I thought it was important, at least from our standpoint. We can't CC everybody, but we can CC our local legislatures, and if we haven't done that on the other issues that we've got important to Clay County, then shame on us. But I think we have. I think we've been pretty diligent in keeping everybody informed of you know, as Commissioner Mojo has said, important projects that probably came about before this letter occurred. So I'm going to support the letter, but I do agree that all of our other issues need to, you know, sometimes when you go to the legislature, you have to have a list of things, but maybe you need to have them prioritized because we not always get everything that we want. And so there needs to be, you know, and I think the city of Moorhead does that. They go with several issues, but they also have, this is our number one, this is our number two, and you know, so I just thought that was kind of.
Commissioner Ebinger?
Just real quickly, last week, and we'll come out with it in reports, our local legislators, as well as a number of the chairs, specifically heard from us, Moorhead, Dilworth, and the Chamber of Commerce, what our legislative interests are. And numerous discussions took place that were really productive. You know, just to reassure you of that, and I think it's going to be an annual event. I think it's going to be a good event. But you're right, we need to speak with clarity, and I think a great opportunity was presented where we did.
Anything else? If not, there is a motion and a second on the table. All those in favor of this motion signify by saying aye.
Aye.
Opposed, same sign. And as noted, Commissioner Kaylee is recusing herself from the vote. That item passes.
Thank you.
Thank you. Number 11 this morning is a request to fill vacancies for 2 juvenile worker positions in the non-secure unit. Good morning, James.
Morning, Madam Chair, members of the board. I'm here today to request to fill 2 positions in our non-secure unit. Both of them have their, we've processed their resignations with HR already. They're just trying to get ahead. The last day for one is on Friday, and the following Friday is another staff that's going to be leaving us. They're leaving us in good faith and everything. They're just moving on. Requesting permission to get those advertised and to fill those so we don't have any gaps in services.
Thank you very much. Board discussion and questions?
Madam Chair.
Commissioner Campbell.
I noticed your request includes with backfill. Can you explain, are there different levels here?
There is, and we have some variable hour staff that have right now expressed interest in that, so
okay.
I would request backfill too if there's any openings, whichever the way it shakes out the hiring process.
I move the recommendation or request.
Commissioner Campbell makes a motion to approve the positions with backfill.
Yes.
Commissioner Gross makes a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Any opposed? Your request is granted.
Thank you.
Thank you very much. The next item this morning is number 12, a request to fill a vacancy for the technical position for our Detox. We have our Public Health Administrator, Kathy McKay, and our Detox Director, Troy Amundson. Good morning.
Morning. Good morning, Madam Chair, Commissioners. Today, we are here to request to fill a vacancy for a full-time technician position. We recently had a resignation, and she'll be done in the next couple weeks, so.
Board discussion.
I'll make a motion to fill the vacancy.
We have a motion to approve the vacancy by Commissioner Gross, a second by Commissioner Kaylee. Are there any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Your request is granted. Thank you so much. Okay, item 13 this morning is an update on COVID-19. Public Health Administrator again. You've got your crew with you.
Yes, Madam Chair and Commissioners. Got the A-team here, so, well, those two are the A-team. Let's see, we'll start our PowerPoint. Let's see. Okay, So as we look at the numbers, we haven't been here for a few weeks, and we are seeing a little bit of an increase, but we want to say that this increase was not, it was expected. In fact, Minnesota Department of Health has been expecting an increase sometime this summer, so it was predicted before we even saw the numbers. So you can see in Clay County, just the week of the 10th through the 16th, we had 29 new cases. The next week, we had 70 new cases, so we did see an increase then. And our preliminary number, all the data isn't in yet, for the 24th through the 30th of April is 81 at this point. And again, this isn't alarming. This was really, we expected with variants. They change. And we know that they're going to, and we expect, as Minnesota Department of Health claims, it's going to ebb and flow. So we'll see some changes that cases may go up, and then we'll see cases go down again. It's hard to predict with this variant. It's because it's always going to change. The big message, of course, as we look at cases and what we've always preached is get vaccinated. That's the best way we can deal with variant strains that change. In Minnesota, you see the new cases also increased from the 10th through the 16th. It was 5,443, then they went up the following week to 7,388. Preliminary numbers so far is only showing 5,572. Again, they're preliminary, so we know that may increase, but we don't know to what level. So in Cass County, we're also seeing some increases over there, the 9th through the 15th, 76 cases. The next week, they had 123. The following week, 175. So they're also seeing a little bit of an increase. And North Dakota is seeing an increase as well. These are the weekly cases by date of test. So you can see, again, we started this graph October of 21. So you see the number of cases. You saw the large increase that we experienced in January, and then the decline and, staying low for a while, and now just a slight increase that we're experiencing in April. Antivirals. We talked about antivirals in the past. This is treatments that are typically given in the first 5 days that someone has an infection. And really, antivirals will help people that have health conditions that may make it difficult for them to get through, the infection. So those kind of at higher risk would really be the great candidates for an antiviral medication. It does need to be prescribed by a provider. And then the antivirals, we checked with some pharmacies locally, and they do have the oral antivirals. So we have Paxlovid, those for 12 plus, and Molnupiravir, something like that. That one is 18 and over, and those are the oral medications. Again, provider needs to write a prescription for that, and then those can be taken at the pharmacy. The IV infusions, the remdesivir and the monoclonal antibody infusions, the remdesivir, it's an IV infusion 1 day for 3 consecutive days. So it's a little bit more concentrated. That again needs a physician prescription and a physician, your primary care provider needs to recommend that you have that IV infusion. It's fairly costly, so that would be something that they would discuss with you. And the FDA now approved for children under 12 who are at high risk for disease as well. So that one can be recommended for those children. And this is really to prevent hospitalizations and worse. So it's really for really high-risk people. Monoclonal antibody infusion is the 12 plus, and that's an IV infusion, and that's the one option that seems to be most effective against the BA2 strain.
There's a couple questions, Commissioner Ebinger.
Yes, I'm trying to make sure I don't have this confused with something else. But on the oral pills, was this not maybe the CDC, but one of the federal agencies recommended it be used more often because there had been a shortage of them early on, and now they had more than they than were being prescribed. This is something they encourage both providers and people to ask for if they believe they had COVID.
Yeah, Madam Chair and Commissioner Ebinger, that is correct. There was a shortage for quite a while, and so they were really giving it to the ones that were really at the highest risk. Now there seems to be a plenty amount of these oral antivirals. So again, the providers will discuss with each individual whether they recommend that they receive that or not. That's correct.
Commissioner Campbell also had a question.
Yeah, thank you. So, but it's important for example, somebody who's high risk, if they have symptoms, to get tested right away. And if they have that positive test, they need to notify, or they should notify their medical provider right away. Because after 5 days, some of these things are much less effective, if effective at all. Isn't that correct?
That's correct. The most effectiveness is within the first 5 days. So if they can get this medication to individuals within the first 5 days of that positive test, absolutely.
Thank you.
All right, keep going.
Okay, Becky?
Good morning. So we do remain in touch with our local healthcare systems about COVID, and so we did receive a few updates from them yesterday, as shown here on the slide. So all in all, really seeing positive trends across the board as hospitalizations remain manageable. They have seen a slight uptick in the number of COVID inpatients recently, but are well within their capacity to handle this increase. So earlier in the year, as Kathy mentioned, during the Omicron surge, antiviral treatments were hard to come by. They were in short supply. There were long waiting lists. Fortunately, this is not the case anymore. And so our local healthcare systems have an ample supply of these treatments on hand as needed for their high-risk patients. So one thing they're really, really encouraging is that anyone that is at high risk for severe disease, to make sure that you're up to date on your vaccinations and receive that second booster when you're eligible. So that should really help cut down on hospitalizations as we see this small uptick of cases.
Any other questions on that piece?
And then this slide shows the number of new hospital admissions per week for Clay County residents, starting in 2021 up until last week. So as we move into a new normal with COVID, hospitalizations will become one of the most important indicators that we're looking at for the impact that COVID is having on our community. So we expect cases to ebb and flow, as Kathy mentioned earlier, and we may see slight increases in hospitalizations as we see an increase in cases. So you can see that we had several weeks without any hospital admissions, and now we are seeing a bit of an uptick. So two admissions per week the past couple weeks for Clay County. And then this graph shows the CDC map of community levels throughout Minnesota. The CDC has made a shift from their criteria that they used to use, and now they use more of a holistic and honestly more complicated metric to come up with or to evaluate the impact that COVID is having on a particular county. So these thresholds take into consideration hospitalizations and hospital capacity, as well as just case numbers. So as you can see, Clay County and surrounding counties are still at that low level of transmission. There are a few counties throughout Minnesota that are at that medium and high level.
In terms of moving forward with life, AC, after COVID, this seems to be an important indicator in terms of transmission, not only for COVID, but any other natural cold season, flu season. Is this something that you're hearing from CDC and within your public health circles, that this is something we'll see more of as we continue to gauge all different outbreaks of sickness?
I haven't heard anything specifically to that. I think that this will become an important indicator to look more at just individual case numbers. We're really trying to move past that at this point in the pandemic or the endemic or whatever we're classifying this as now. So really looking at the broad impacts across the community versus just case numbers.
And I think it will be important. We've had crazy bouts with different strains of the flu virus that have been really scary as well, and I think it would be helpful to track that on a community-wide map so people can see going forward.
And then this is the vaccine breakthrough report that MDH puts out every week, and then there's a side-by-side comparison of the past couple weeks. So about 10.6% of people in Minnesota that are fully vaccinated have wound up testing positive, which is what we call a breakthrough infection. So as you can see, hospitalizations and deaths remain extremely low among those that are fully vaccinated. These vaccines really are doing a remarkable job at keeping people out of the hospital and preventing deaths, even though we are seeing more breakthrough infections than we did with previous variants.
Questions? Commissioner Campbell?
I still want to, I always like this report, but I still want to also point out, I remember when the vaccines first came out, you were wondering, should you take Pfizer, should you Moderna, or the Johnson & Johnson, or whatever, but one of the things I've said from day one was that you might have, each of them were slightly different, but I think most of them were in around that 90% effective. So again, you see here, the 10% is, it shouldn't be a surprise because it was originally suggested that it's not going to work for everybody. However, you go to the next line, and the breakthrough cases when it comes to hospitalizations, you got a 99.7% chance of not being hospitalized if you've been vaccinated. That's a pretty interesting and pretty, it's pretty hard to argue with that statistic. So, I've had my shots and my booster. I haven't had my second one yet, but I think I'm ready for it. But yeah, the evidence is pretty clear.
It is, I agree.
So, thank you.
Okay, we'll move on to talking about vaccines and testing. So the first slide, the statewide vaccine data looks a little bit different, but as of 5/1, it's kind of showing you that light blue color is those that have had the first dose. The dark blue is those that have completed the initial series, and then the green is the boosters. So just wanted to kind of point out that we are seeing a little bit of a lack of a response to those boosters, so want to continue to encourage people to take advantage of those when they're eligible. And then our highest, uptake on that vaccine is still that 65 and over, including the boosters, even though they're a little bit behind there. So yeah, that's the statewide data. And to go to the next slide, just to talk a little bit about the booster eligibility. So what we do post on our website every week when we list our clinics that you can register for. We also put who's eligible and the time frame for that. So it's on the county website. And then also, so who's eligible the first booster? That's anyone who's 12 and over and has completed that primary series can have that first booster. And then who's eligible for the second booster? Anyone who's 50 and over. And then anyone 12 and over with the moderate to severe immune compromised conditions. And then Johnson & Johnson, if you had the one first dose in the series and the second dose, that first booster, then you're encouraged that you could also have a second booster if it's been at least 2 months since your last one. So, and again, all of this information and the details of how many months between doses is on our website. So I'm going to go to the next slide. I didn't even notice the boss left. Okay, then vaccines for children under 5, and then the boosters for that 5 to 11 is what we keep waiting for. So just wanted to share this information. Moderna has actually officially applied for that emergency use authorization as of 4/28. So they're asking to be able to serve that 6 month through 4 years of age. And then Pfizer is still working on that booster dose for that 5 through 11 that they are currently eligible for. A primary series for Pfizer, but they're working on that booster dose as well. And then the younger population, Pfizer's looking at that too, but looking at the number of doses that they would need for that initial series, if it should be 2 or 3. So the FDA has scheduled in June to be meeting with the ACIP, the Advisory Committee for an Immunization Practice. And so they're looking at these things in June, so hopeful that we will have a vaccine available for that 6 month through 4 year olds, and then also a booster for the 5 through 11 coming soon. Okay.
And this is just looking at what we've been doing for Clay County Public Health. We don't have our total, but we keep thinking that we're going to meet that 20,000, but we're just short of that. But a lot of vaccine that Public Health has been providing, but really just want to point out that we continue to serve clients every week. So this last week, which was through the 24th, the week of the 24th, we had 21 doses that we administered, and all of those were booster doses that week. And then it's just under 200 that we've done in all of April for public health at our Family Service Center. So then, next slide. Okay, so public health clinics every Wednesday between 9 and 4, we hold a clinic for anyone who's eligible for a vaccine at any age. The only thing we haven't had is Johnson & Johnson. And so we continue to do that weekly, plus we are posting on our website who's eligible and when. They can register or they can call and schedule an appointment, and our number is up there for the clinic to call and schedule. But we also are not turning people away if they can't be seen on Wednesday. We invite them to come in for one of our clinic schedules. So most of the clinics are being handled by our clinic nurse. Cheryl is serving most of them, and she's there in the clinic, so we encourage them to come in if a Wednesday won't work. We try to get them in on Wednesday because of the fact that we end up wasting doses, but the state is saying there's more vaccine, plenty of vaccine. So they'd rather we were wasting vaccine than not serving someone. So you can call, schedule an appointment, and we're happy to serve you there as well. In April, we did do another Concordia clinic. We've been swinging through our universities to provide vaccine and boosters, and we did have a successful clinic in Concordia in April as well. And we continue to go work with corrections and with our long-term care. So the onesies, twosies, Cheryl is going to serve them as well. So, and then the next slide is on the vault testing site, and just kind of wanted to show how our positivity rate has kind of, gone up, our testing rate. And we do have our data. You have this. Do you guys have this? Yeah. So our data is showing us that even though we're not doing a lot more tests, we are seeing an increase in those that are positive that are coming through. So we're happy that we continue to have that vault test site available to us. Our positivity for the week of April 25th was 14.05%, and the week before, April 18th, it was 6.82%. So seeing the numbers, 337 for the week of the 18th and 363 tested, but what we're seeing is more positives are out there. And again, this is just a reflection of what we know in terms of testing, but there is a lot of self-testing out there, and those are not reported. But it tells us a lot when we look at what our positivity rate is doing. But again, not that that plays against our hospitalization, because our hospitals are handling those positive cases. So. And that's pretty much it, unless you have any questions about that.
Commissioner Campbell.
Not that I have questions. Well, my first question is, have we heard anything about the vault testing site and how long they plan to keep that open?
Kathy did just mention that, and I've forgotten. Do you know? Was it? Yeah,
I believe she said we don't have a definitive close date for them, but they're thinking through June.
Okay.
Becky.
So maybe something just to keep in mind in the event that we're to close, what will be our plan of attack for testing? Some people have a little bit more confidence, for example, in the vault testing than the home test. And so what would be our plan? And do we need to be talking about what financial impacts that could have to our local public health department if vault is closed and we take over? Because we need to be ready for that if that were to happen. I don't expect answers to that today, but I think we need to be planning for that.
Okay. Important. Anything else? All right. Thank you so much for your work, as always. We appreciate you. Okay, item number 14 this morning. Before you leave too, is I know that our message to public health has been feel the need to come whenever there's anything pertinent to share. Obviously, we're learning how to live with this, but for instance, if you hear that the vault site is closing or
or anything that we should be aware of, feel free to come back. Thank you. Okay, item 14 this morning is a request to fill the vacancy for solid waste manager. Steve?
Thank you, Madam Chair. This past week, Kirk Rosenberger, our solid waste manager, has notified us that he's ready to move to Montana, potentially. And as we'll be putting in his retirement, or has put in his retirement, his last scheduled day is June 17th. He'll be taking some vacation time through July, but his last day in the office will be the 17th. Our hope is that, I know that 8 years ago, prior to Kirk coming, we had some challenges filling the position, and so we would like to get moving as quickly as possible in hopes of getting someone in place, with the understanding that we have some pretty significant things happening right now with projects here within the solid waste department. So with that, I'd yield for any questions.
Thank you. I think it's also important to note that last week the PIC committee did meet to discuss this request, to talk about scope of this position moving forward. We really feel that this is as structured, is a very efficient department. As you noted, there are a lot of big items happening with solid waste and environmental issues. I think it's important this board move on this, and hopefully we can get somebody in and a tiny amount of overlap if needed. I also think it's important to say that Kirk has been a great asset for Clay County, a staunch supporter of our needs at the Capitol, and really was so vital in securing the grant funding for our transfer station. That is, as always, such an important part of a lot of the department heads that we have, is advocating at the state level. But we certainly will miss Kirk and his work. Hope him the best as he moves on to the mountains or wherever that may be. Board?
I'll make a motion to approve the request.
There's a motion by Commissioner Gross to approve the request.
Second.
Second by Commissioner Campbell. Further discussion? Comments? Timeline is right away, correct?
That's correct, Madam Chair.
All right. All those in favor of this motion signify by saying aye.
Aye.
Any opposed? The request is granted. Hopefully we can get some good applicants.
Thank you.
Item 15 this morning, committee reports. Commissioner Kaylee, would you like to start?
Sure, thank you, Madam Chair. As we sort of mentioned previously in this meeting, Commissioner Ebinger and I went to the FMWF Chambers Day on the Hill in the Capitol, and we were there the 27th through the 29th. I can't say enough about the amazing work that the Chamber did to put that event together. We were able to meet with Senators Ken Eakin, Mark Johnson, Tom Bach, Sandy Pappas, Representatives Paul Marquardt, Heather Keeler, Jordan Rasmussen, Dean Erdahl, Fu Lee, Mohammed Noor, and I'm sure I'm missing a few in that list as well, but all of our local legislators, as well as some chairs of important committees, and to bring some of the priorities of our area to them for consideration. Some of the things we talked about were the unemployment insurance, some border community issues, bonding projects like the City of Dilworth's Fire Department Fire Hall project, MSUM's Weld Hall project, City of Moorhead flood mitigation dollars. We were able to talk to Representative Keeler about SCORE funding, and I followed up with her again after that to get her some more information that she had requested. And also talked to Eakin a little bit about our commitments that we have made to some of the big projects around the state, and with increased costs on those projects that have been granted dollars, you know, what could they be thinking about doing to ensure that those projects get finished? And I'm sure if I'm missing something, Commissioner Ebinger can fill in more on that. But again, thank you to the Chamber for all their work on that. The team that went down from Moorhead, Dilworth, local business leaders that attended as well. It was a really worthwhile couple days. The last day, I guess, we also met with Minnesota Department of Employment and Economic Development, DEED, and heard updates from them on what's in the works. And it was kind of neat to be there while the deal was being struck for unemployment insurance and see that come together. Also, the U.S. Chamber gave a presentation on some of the things that they're seeing in workforce as well. Then yesterday, I attended the Moorhead Planning Commission meeting. We had 3 public hearings. The first was a request of Compass Apartments for a conditional use permit to exceed the 45-foot height limit in commercial mixed use at 630th Avenue South. So that is that old Days Inn motel, which is currently being demolished. And they have a plan for a 204-unit apartment complex that's going to go in there. Interestingly, there was only support for the project that we heard at that meeting. There was some letters submitted from businesses that are neighboring saying that this particular developer has been so great and is enclave to work with. And they're excited about the project. Also, the church next door was singing the praises of Enclave as well. They're working together on how to develop some of the green spaces to be mutually beneficial for the church and the community that'll be moving into this apartment building. So that was approved. The second was a request of 4 walls storage to rezone from institutional to community commercial in the former MAPS bus barn up on 15th Avenue North. The idea is to put in some self-storage into that space. It looks like there's some adjacent self-storage already in American Crystal Sugars across the street. The feeling was that this rezone was appropriate, moving from institutional to community commercial, and we recommended approval for that. The final public hearing was a request of MIG Properties for a conditional use permit for adult and child daycare facilities at 1110 14th Street South. So that's the former Edison School where our current testing site is for COVID. They have had this conditional use permit in the past. I believe 2018 is when they got that, but they were unable to utilize that for a variety of reasons. So in order to keep the space as a possibility to include daycare facilities for adults and or children, they were just applying for that conditional use permit. Not saying that they're kicking our testing site out or any other businesses that are currently in there, but just to make sure that that remains a viable option for anybody who would like to move in the future. And that was recommended for approval as well. That concludes my reports. Thank you.
Thank you, Commissioner Cayley. Commissioner Gross?
I didn't have any official meetings this week. The only one I went to was a retirement for Sharon Walls. We've seen in our paychecks or messages for our paychecks for the last, for as many years as we've been here, I guess. So.
Thank you, Commissioner Gross. Commissioner Campbell?
Okay, on April 27th, Wednesday, I attended the Prairie Lakes Solid Waste Authority meeting, and as usual, we received the summary of monthly revenues and expenditures, and that is in line with what we had projected. We got a report on our $2 million project budget that was for bonding purposes, and we did learn that that was all the projects are now complete under that bonding bond funding. The projects did come in about $200,000 over the anticipated costs. The good news is that Brian, the plant manager, has said that there's 3 different line items within his 2022 budget that are falling below, and that he believes that those funds can be made up through those line items without impacting the rest of the budget, or having to come up with other sources, reserves, for example, to pay that. The plant continues to run really well. We did get a first report on a wage rate study for that facility. There's a lot of, that facility has a step program that has it from beginning to end, is a 9-step program. For example, ours at the county is 12. And what's happening because of these market conditions, what's happening is they're having to hire people on step 5 of a 9-step grid. And obviously when you do that, your grid something's wrong with your grid. And so we're reviewing that, and we're probably anticipating making some adjustments to that. If indeed it was based on the recommendation by the consultant in 2022, if we were to make that effective July 1st, there'd be about a $42,000 cost impact to the 2022 budget. In 2023, there would be an additional cost for that full year of another $120,000 to the budget based on that information. The good news on that piece is that in 2023, because of some crossover refunding that we did on some of our bonds, we're going to save about $140,000 a year on interest that we currently have in our 2022 budget. So the net impact for the facility, even if this is implemented, and again, we have a finance committee set up to go over that, to review the recommendation. But if it does happen, I think we're going to probably still be able to, in 2023, probably see little to no tipping fee increases as a result of that line item, if it gets approved. We also then did approve a purchase of a front-end loader. It was anticipated for 2023, but because of what we're seeing right now with our increased costs, there's a 10 to 12 month delivery component in it. And if we waited to order that in January of 2023, now you're probably out till the end of 2023. And we're also very concerned about the escalated price that would happen. They're anticipating we could lock the price in, or we could already see probably outside of the 30 days the potential for a 10% increase in price already, just in that short time frame. So our board did go ahead and approve the purchase of that moving forward to lock in that price. And the good news is 2 or 3 years ago, we did implement a internal service fund for that facility, and those funds will be able to come out of that internal service fund again, meaning there will be no impact to the budget because those dollars are already in the bank to pay for it. And then on the 27th, I think it was the 27th, we also, the 28th, we had the PIC meeting, and the sole purpose of that PIC meeting was to discuss the retirement of Kirk, and I want to echo Commissioner Mojo's comments regarding Kirk and how important he's been over the past years with the solid waste department, and really specifically how important he was with working with our legislature on funding that we were able to obtain through his efforts. We did look at if this wasn't a time to do some potential reorganizing. We did have that discussion, And, because this is a enterprise fund, we just felt that probably for now, would not be the appropriate time to make alterations to that, but we may be looking at how different areas of solid waste might be managed underneath the supervision of a solid waste administrator. Then on Thursday morning, it was kind of a solid waste week last week. The 28th, we had our solid waste advisory committee meeting. We did get an update from construction engineers. They gave us some drone footage of the project out there. That's, even with the consideration of the wet conditions, we're seeing some real positives going on there moving forward. We did have Joe from Comstock Construction come before the SWAC meeting to talk about the landfill project and the issues related to some unanticipated inspection costs, the gas line sagging, the boiler not working, and then the fourth one would be that brought up about a berm to make some additional protections. And I think Steve might be talking a little bit about we're making some progress on some of those issues where there's disputes between the county and the contractor and the subcontractors, and we're going to try to hopefully come to some solutions. We also got a report from Earth Week happenings from Shannon Thompson from our department. She gave a very good report, and obviously there was a very busy week for her and the solid waste crew in regards to that with all the different presentations. But we also noted that work isn't just that week. There's a lot that constantly goes on in terms of issues related to recycling and solid waste in general to improve our landfill issues. Let's see, then on that afternoon, we had the MCC JPA meeting, and we did approve or we recommended to the Diversion Authority an organic farmland letter, which basically outlined how we felt the existing land that the Diversion Authority owns, organic land in Minnesota, how that should be preserved and offered to landowners in Minnesota who have organic land that we still need for the project, so that there can be a exchange option of it. So that was the recommendation, but that's the first priority that should be considered. And so I think there was like a 5-step bullet point process where if that one isn't needed, then it would go to the next one and the next one and the next one. So we did approve 2 farmland lease agreements, and then we did approve 1 task order amendment to SRF land firm, and that's because of the now moving forward with the additional work necessary in dealing directly with landowners. So we approved an amendment to the original cost that was anticipated for that. That concludes my report.
Thank you, Commissioner Campbell. Commissioner Ebinger.
Thank you, Madam Chair. Last week, on Wednesday, the 27th, I attended the diversion finance meeting virtually. Mike Redlinger, acting City Administrator of Fargo, introduced Steve Sprague, the interim Fargo Finance Director. He will be handling, with the retirement of Kent Costin, he'll be handling the role of overseeing the finance administration for the Diversion Authority on an interim basis. It was a fairly short meeting. We approved payments. Had 1 contract we approved. There was a discussion of the RIMP loan for relocation of farmsteads. They want to go ahead and increase the budget on that from $5 million to $15 million because of the use of it. So that'll be going to the full, or that may have gone to the full board. Then we approved a list of Fargo projects. I did miss the board meeting of the diversion the following day because I was in St. Paul. Commissioner Cayley gave a pretty good description of the Chamber of Commerce Moorhead Area Day at the Capitol that we had on the 28th and 29th. A couple of things, observations I'd like to make. Shannon Full with the Chamber and her staff did a remarkable job. I've done these things for, you know, in Minnesota and Arkansas, going to the legislature for probably 30 years. I have never seen the ability to prepare people, and a big group of us, there were 12 to 15 of us. We were given the information we needed. We had a chance to sit down and discuss it and go in prepared to work as a group. A lot of that I would give to Kurt Zellers, who's former Speaker of the House. He was with Synergenic, and the Chamber retained him to help coordinate this entire thing. As a result, we got to see the chair of Senate Investments, Senator Back, Sandy Pappas. She's minority senator for capital investments. We had a brief conversation with Representative Fu Lee, the capital investment chair. We met with the people that needed to hear our message along, as well as our local delegations. And it was a very busy day. It could have been a fairly chaotic, but the thing was structured to work well. And it represented our area. We had Dilworth, we had Moorhead, and we had Clay County. And the interests of those entities were represented well. So I think it was a good trip, productive one. And they want to make it an annual affair, and I think it needs our support on that because it met the needs of this area. And I think all of us understand how much people in the metro area of Minnesota need to be informed and enlightened on what's going on out here. You know, we are not a 30,000, 40,000 community out in the middle of the plains. We're part of the second largest metropolitan area in the state of Minnesota. And that lesson surprises people who have been in the legislature for a decade when you start giving them the details. So I think we did a good job of getting that point across. It was good to meet with Deed, Ariel Dannon, their legislative director, met with us for what was supposed to be 30 minutes and it turned into an hour and a half. We really got good information and it was a good communication on that. Then on yesterday, had a meeting with Joe Rosso, the executive director of the EDC, Dan Molly, Moorhead City manager, and Judd Graham, the current chair of the EDC. This is part of an ongoing discussion that we've had probably now, well, since I was elected and put in this position, about the need for the EDC to address Minnesota issues. And it's an ongoing process. We've identified a group of Minnesota stakeholders with the EDC. We're going to include several people. I'll tell you right now, Commissioner Cayley will be there. She's a board member. But Minnesota players will be having discussions on an ongoing basis, hopefully to come up with a list of objectives for Joe to meet to make sure that Minnesota is well represented in these issues. And that'll be an ongoing process I'll keep you informed of. And that completes my report.
Thank you. Last week, I also attended the Prairie Lakes Solid Waste meeting, as Commissioner Campbell talked about. I think they're having really good discussions that need to happen based on the needs that arise. But certainly, I think that risk manager conversation was really of interest to me, particularly because so many different units of government at those tables are involved in some substantial projects and programs, and having
that conversation in their minds, I think, is really important. So happy to see that was part of it. We did have the SWAT committee meeting the next day, Solid Waste Advisory Committee. That board continues to bring up really good points of interest. It was noted from Everett Nelson from Holly Township that they did send some correspondence through their township on different recycling opportunities locally for them, and landfill questions, and the citizen drop-off area that they have. Really, it was interesting to hear that at their township meeting, they had really good feedback, residents that came with good feedback, and thank you for letting them know what's available, and really from the county's perspective, encouraged our staff to make those notifications available publicly. Oftentimes, we know what's going on because we hear about it at meetings, but not always does the public hear about that. So really felt it was important to get that message out and let them know what is available to drop off and where. So good input from Everett on that one. We did have the PIC committee meeting later on after that. It's been covered well. Yesterday, I attended the transfer station meeting, construction meeting. Now with the sun shining today, hopeful that we can start to see some substantial work out there. It's been an onslaught with the weather is not necessarily cooperating, but certainly as you drive by that, very exciting and hopeful, and trash week next week or next year in our communities will look substantially different because of the availability of that. So excited about that opportunity. I had several conversations last week with Mayor Carlson from Moorhead and Dan Molly about the legislative session and advocating and communicating our projects and needs and priorities as you went down to the Capitol. I appreciate your perspective and your willingness to work on that. So did give them an update on those pieces. I've been working with Brian Martinson from AMC on the SCORE funding request that we are continuing to try to push through the finish line. He reiterated the need for outreach to not only our local legislative representatives, but I know I had Steve forward to you here a couple weeks back the need to reach out to different legislative reps to sponsor or to encourage them to keep that in the tax bill. That is vitally important for our need. And then also talk to him about the MPCA meeting and the $4 million request that we had proposed to the bonding shares. That continues to be really important. So working with Brian on that. And this morning I did get off the phone with Senator Eakin, thanking him for his continued support on the projects that we are prioritizing and asking for his commitment on that. He did reassure me that he continues to know what our priorities and needs are, so I appreciated his perspective on that. And this morning, with collaboration from the chamber and Representative Fishbach's office, was happy to take part in the tour of the Moorhead Area Career Academy. I know that this entire board would have wanted to be there. Unfortunately, with scheduling for Congresswoman, that's at short notice. So it was great to have her part of that and walk through that, and to see, like I said earlier, the need that area or that program provides, not only for students and meeting students of all different abilities at their level and providing them with job training, but the workforce that is coming out of there. 20 CNA qualified students every semester are coming out of that. And we've heard from our medical community how vital that need is, and that's just incredibly exciting. As you recall, Senator Marquardt is championing a bill that would earmark $40 million, with $10 million of that going specifically for the Moorhead Area Career Academy to work with our colleges and the other smaller school districts within Clay County to make sure that we're able to meet the needs to all students countywide. So as you reach out in the next couple of weeks to our representatives, make sure and ask for their support on that piece as well. That continues to be significantly important. And I believe that concludes my reports.
Thank you, Madam Chair. 26th, had a number of had a conversation on a number of different issues with Mr. Milton on county-related issues. On the 27th, we had county management. We talked about the upcoming budget, payroll, and also some of the workforce challenges that we're having in some of our departments. On the 27th, I also met with our local administrators, city managers, and in regards to the Red River Regional Dispatch as we continue to move forward with both plans for a potential site and operations contract. Of that, SWAC meeting was on the 28th. That's been addressed. Also, the PIC committee, which has been addressed on the 28th. Also, the MCC JPA meeting, and I also met with juvenile detention staff in regards to programming, some potential legislation, and just looking at their overall numbers there. Yesterday, participated in a tour out at the landfill as we've worked through some of the different challenges with the landfill project, just kind of taking a firsthand view of some of those different things. Again, that afternoon, we did meet with Comstock and Burns and Mac on our punch list. There was an additional license that needed to be done that wasn't part of the initial plan that we've been discussing. Comstock yesterday agreed that they would cover the cost of that increased license. This morning, the boiler, all the boiler parts came in over the last week, and they're looking to work with the vendor and Brett this morning to work on that. They're concerned, or they believe that it's kind of more of a pressure line issue than a boiler issue, which also, if we're able to take care of that, would also potentially factor in some of the frozen pipes that they've had out there. And so we're making positive steps there. Again, we'll continue to meet on a weekly basis till we get that punch list completed. Yesterday, I also met out at Spring Prairie Hutterite Brethren community with Cornelius and Interstate Engineering, along with Matt Jacobson. Interstate Engineering really was just looking for a path forward as we talk about the intentional community that this board approved a number of weeks ago, and also their path forward with a new ready mix concrete plant that they want to be putting in here sometime later this year. So we had a good discussion there. Also had the opportunity to tour a good portion of the Hutterites community. If there were a way that we could get all of us out there sometime, it was an absolutely amazing day. It was some of the best 3 hours I've spent in the last few years. And so they do some great work out there. Just some of the highlights of, they employ over 300 employees outside of the people that live in the Hutterite colony, and both in the concrete area, and also welders and truck drivers. And so it was good to see that. We also got a plan of the layout of where they anticipate in utilizing the intentional community for different housing, and also saw their new community center, which is in the process of being constructed. So, and so that was just an enjoyable tour. So I appreciate Cornelius taking that extra time. And I think that concludes my report.
Thank you, Steve. Just to follow up on that, I certainly feel that that site has really provided a lot of dialogue between a lot of different county departments and committees that we all serve on. Certainly feel that something like that could happen if that was something we were to have a advertised meeting on. I know that we have several, if we wanted to make it like an economic development type tour, I know there's several shovel-ready sites for commercial development throughout Clay County, not just within what MetroCog has been working with Joe Razzo on those pieces. There's some items out in the outer parts of Clay County. We certainly could work on something like that if needed. Any other items? Commissioner Gross.
On May 17th, our meeting there, I'm going to be missing that one. I got another commitment.
Okay.
Actually, that is a good point. We had talked about needing to possibly meet on the 5th Tuesday. Steve,
Yeah, we certainly could,
would you want to wait on that as we get closer if we're
yeah,
identifying?
maybe we can have some further discussion next.
Okay, all right. Okay, we'll wait for that. Colleen, do you have anything? Brian? All right, thank you. We are adjourned.